Another area where we often get fake stories comes with Obamacare horror stories, which seem to be debunked day after day after day. And here's another one, which is going to be a sad reality for the right, which continues to oppose Obamacare. Ted Cruz continues to say we might even be able to repeal Obamacare while President Obama is still in office. 2 months after Americans started getting health coverage under the Obamacare exchanges, the uninsured rate is dropping. The Gallup Healthways Wellbeing Index shows that in the fourth quarter of 2013, 17.1% of Americans didn't have health insurance. So far in 2014, remember it is only mid-March, that number has dropped to 15.9%. This is, and listen to this very carefully, the lowest uninsured rate since the beginning of 2009. It has been 5 years. The uninsured rate drops have been disproportionately seen in lower income groups and among African Americans. Now, we can't ignore the fact that many of those who are opposed to Obamacare won't like that it has had a disproportionately positive effect on low-income individuals and on African Americans. That's just a reality, ladies and gentlemen. We have to understand that. However, we have to take a look at this more broadly, which is that every fraction of a point drop in the percentage of Americans that are uninsured is a slight increase in the political problem for Republicans who put all their cards on the table against Obamacare and on the bet that Obamacare wouldn't work and that people wouldn't like it. Every time this trickles down by 0.1%, we see the problem for Republicans trickle up.
And I think as we see that happen, the lies will just get crazier and the stories will just become even more absurd. They're going to have to mess with numbers. They're never going to admit that this was a good thing, ever.
Well, remember that not all the provisions have even kicked in yet. So I think we still have a long road of equivocation and bizarre, completely unbelievable statements from the right. And this is not mission accomplished or anything close to it. A slight reduction in the uninsured rate and millions of people signing up for Obamacare, it's good compared to what the right said would happen, but it still is not the system that we should see, that we should have, which is that of single-payer healthcare, universal healthcare, that which every other country at our level of development around the world has already figured out that they have. That's really what we need to move on to next. The window is closing quickly for those who still want to take uncertainty around Obamacare and some opposition to it among the public into a repeal. That window is closing, but there's an even bigger battle on single payer here.
There is, but at least now we do have people paying into government exchanges for their health care. So there's at least a link there between, healthcare and government. And hopefully one day that we can just transition completely.
Like that video? Please subscribe, click the button below. Didn't like that video? Please subscribe, click the button below.